This section is on aminoglycosides. So what aminoglycosides are is just another class of antibiotics or antimicrobials. They're bactericidal, and what they do is kill by inhibiting the protein synthesis within the bacterial cell, so then it will die because it can't function without it. Okay, I'm going to get started here. All right, this is another quick one. Aminoglycosides, gentamicin, tobramycin, amikacin. You may see gentamicin, you may see tobramycin. You might not see amikacin too much, unless you work in like specialty areas like transplant units. You may see like all of these other types of antibiotics. This one's a narrow spectrum antibiotic. It's very specific. It's used for aerobic gram-negative bacilli. You have to be careful because it can cause inner ear issues, kidney issues, not absorbed from the GI tract, and there's some microbial resistance with this too. Some adverse effects are kidneys, ears. All right, so with these types of medications, since it does cause a lot of toxicity, remember there's like the penicillins, cephalosporins, we said like it's low toxicity. So we don't have to really check blood levels, but with these you have to check blood levels. So you're talking about these trough levels again that I mentioned with vancomycin because of the adverse effects. You want to make sure it's not toxic in the system. There's some hypersensitivity reactions that it can have, and you have to be careful if you're using it with general anesthesia. So for example, we won't prescribe this stuff if they're undergoing anesthesia. If they're on it, we'll have them stop it before they go for surgery. All right, so to move on. So other adverse effects, they can have some hypersensitivity reactions. That would be your rash, blood dyscrasias, and of course there's always others. And when you think of these, when you go pick up your medication at the pharmacy and you see the side effects, there's a whole list of them. So you have to remember also that when they go through clinical trials, people are in the clinical trials, they can get a runny nose and they have to report it, and it has to go on the side effect sheet. Does it mean it's from the antibiotic? Not necessarily, but they have to put it on there. It's mandated. Okay, so dosing. It's usually a single large dose every day, or they can do 2 to 3 smaller doses. It just depends how it's worked out with the pharmacy. So usually the pharmacy and the physician work together on this. You do this, the trough, so you'll have the lab come up and draw the blood to do a gent trough or a vanco trough. Vancomycin, remember, is in the other class of medication, in that miscellaneous class. And then you'll see if there's any toxicity, or if it's too low, and then they'll adjust the medication dose, they'll adjust the times. So basically, these are ordered, and then the pharmacy can adjust the medication times and doses with collaborating with the physician. And when we do peak levels, peak level would mean that you draw it a couple hours after it's given, or a certain amount of time that the pharmacy says to draw it. All right, so samples for peak should be taken 30 minutes after giving an IM, oh here we go, or completing a 30-minute IV infusion. Sampling for trough levels depend on the dosing schedule. So divided doses take sample just before the next dose, and the once daily, it's a draw single sample 1 hour before next dose. Okay, I don't expect you to memorize these at all because they can be different depending on your hospital, depending on your protocol. It's also a little different for vancomycin. But just so you understand why we're drawing peak and troughs and what it's used for. So gentamicin is what really I was talking about for the peak and trough. It's used to treat very serious infections, Pseudomonas, E. coli, Klebsiella, Serratia, Proteus mirabilis. So these are ones that are causing more severe infections. And again, we talked about again, so this is repetitive, so you should remember it, is the nephrotoxicity and ototoxicity. These are other aminoglycosides that are out: tobramycin, amikacin, neomycin, kanamycin, streptomycin, paromomycin. So most of these you won't see too much. You may see neomycin, streptomycin, sometimes tobramycin. But again, you would just expect to look these up if this was ordered, but it's not a common medication. And that's it on these medications here.